Okay, great. Welcome. It is so nice to see all of you joining us this evening. What a large crowd. I want to say to the CEO, I am on call right now, so if you hear my phone, please pick it up. Okay, why don't we get started? So Dr. Tirmizi and I have been colleagues for quite some time, and I'm really happy to be speaking with you tonight. We'll go to the next slide. I wanted to talk just a little bit about my own personal journey, and there is a reason for that. It is all around preventative health as women, and I'll kind of walk you through this. So who am I first and foremost? I'm a mom to 4 beautiful children. I am also a daughter to an amazing mother that I lost too soon. I'm a partner to a husband. I'm a sister, and I'm a friend. Now, beyond that, I am a health system executive at Lakeridge Health, so overseeing clinical programs. And then, as mentioned, I'm also the regional vice president of the Central East Regional Cancer Program. Again, there's a reason that I'm telling you that. I had certainty about 25 years ago about what my path would be and where I would land in the future. I started at McMaster University in undergraduate kinesiology in that program. I then conducted my master's, followed by a PhD. I went to Calgary University in the Faculty of Medicine to do a clinical placement. My dream was to go to Copenhagen. And all of that was to ensure that I would become a productive academic professor in a major university within this large world 25 years ago. I also had received the Women in Science Award, 2 in Canada, and I thought, oh wow, things can't get any better. I traveled across the province teaching young girls the importance of preventative health, about diabetes, about cardiac care. The list went on and on and on until everything became very uncertain. My mother was diagnosed with breast cancer in my 20s, and my whole world stopped. I was a new mom. You can see the picture there of just completely being scared, terrified. What does a new mom mean? My mom in this picture is to the bottom left, and that's my little guy. And then I'm at the back with my sister's little girl. Born within 2 weeks apart, and Heidi and I, my sister, we absolutely crumbled when we received the news. My academic path became very uncertain. Hospital leadership became my calling. I knew I had to come home in those last days to be with my mom. I initially started as frontline at the McMaster University Medical Center. I then took a leadership role at the Rouge Valley Health System. And then I went to Lakeridge Health, and the rest is history. I then started to just continue in positions at Lakeridge. But the one thing that I will never forget is in those scary moments when my mom had her very first chemotherapy treatment, and my sister and I were shaking at the knees with babies in our arms. I thought, wow. I looked around and I said, Mom, one day I am gonna oversee this cancer program. I promise you, I don't know how, but I'm gonna work really hard to do that. She passed shortly thereafter, but I have to believe she's looking down and knows that I'm now overseeing the regional cancer program. My eyes just spotted my sister. So, why am I saying this? Preventative health is so important to us as women. And so you have to take those proactive measures. We have lots of information on healthy lifestyles. There's booths here today that are talking about that. We have massive provincial screening programs. Had my mom underwent cancer screening through the Ontario Breast Cancer Screening Program, the OBSP, she would be here with us today. We also have a huge focus on population health. So we'll go to the next slide, and then I'm going to hand over to Dr. Tirmizi. Population health is really an approach where we are trying to improve the entire health of a given population and really focus on decreasing health inequities among population groups. And this is what Cindy spoke about. We know as an organization, we have to understand the communities and the people that we serve, and then we have to respond to the disparities to ensure best health outcomes. Population health is influenced by many things. A lot of people will say, well, really, it's just about my health and my genetics. It's not. It goes beyond that. Pop health is influenced by income, by social status, by education, where you live, those who maybe don't have access to housing. These are all things that can significantly impact the overall health of a population, and it's far beyond just genetic makeup. Thank you for listening to my story. I'm so appreciative you're here. I'm going to hand over to Dr. Tirmizi.
Hi, everyone. I'm going to try my best to stay within this 6-minute window, but I'm going to start with a quote. The quote is from Martin Luther King: "Injustice anywhere is a threat to justice everywhere." And Dr. Jane Philpott, our new primary care branch lead for the province, actually aligned this with healthcare. So what she said was, ill health anywhere is a threat to wellness everywhere. And it really ties in with what you're saying, Kirsten. Population health means really how are we all doing as a community. As you've heard, I'm a primary care physician or a family doctor in Pickering. I've been there for 20 years, proudly, just love my patients. I'm also one of the primary care co-leads for the Durham, Ontario Health team. Now, honestly, I have to spend a little bit of time just thanking Cindy. What you said right now, Cindy, with all of the things Lakeridge is doing, I would have to say I am so pleased to be here as a primary care provider, because everyone you see back there, that is the community. And honestly, what the Durham OHT or Ontario Health Team is, a collaborative that brings the community together, but we would not be what we are if we didn't have our strong acute care partners. With that, basically what I want to say is, I think I want you guys to think about what is primary care today. Yesterday was something very different. As Kirsten told you about her family story, I came as an immigrant when I was 6 years old from Pakistan. And then unfortunately, my dad was an undiagnosed diabetic with heart disease and passed away actually younger than I am today. So when we think about all of the changes in the last few decades, what we have to say is primary care is your first point of entry. It's unfortunate that in the Durham region, we have 80,000 patients that don't have a primary care provider, and it can be a physician or it can be a nurse practitioner, but it is that regular provider that you call home. I would probably say when we think about screening, I want you guys to think about yourselves, but think about your neighbors, think about your family. There's the cancer screening program. So mammograms, for example, we're here for women's health, have been now, the age has gone down to 40 plus, right? So if you know someone who's over 40 who hasn't done their screening, pull them in. It is a life or death decision for some people. Colon cancer screening, 50 and up, right? I know it's an annoying little kit, but it comes in the mail, really easy to do, and there's an expiry date on it. Now, one of the things I do want to focus on is beyond women's health. When we talk about colon cancer screening, mammograms, there's always also, the screening that is not just a cancer screening, the chronic disease screening. When you look around, look at the diversity, look at the beauty of the diversity. So many things have changed over what I would say when I started 20 years ago and what I would say today. One of the key things is, honestly, like as primary care providers, we need to look beyond what these screening guidelines are. For example, Durham Community Health Center has the Black Health Strategy. Why are they doing that? Because there's certain things that are higher risk in the Black community. There's diabetes in the South Asian community. Why should we be looking, not at a certain age or a certain risk factor, but really saying, can we hone in on what are those nuances for that certain population? And then there's all of the different First Nations communities. So I want everyone to think about primary care still as your first place to go. But I would definitely also say that if you don't have a place to go, in Durham Region, just like Cindy said, there is lots and lots of great screening programs that are live. There's our local urgent care clinics that are now comprehensive urgent care clinics. There's also something we just launched in partnership with the OHT called the iCare Virtual. If you're unattached or don't have a regular provider, it's icarevirtual.com. Go on the website, register, And we're trying our best to start working on really getting you that all of the screening and preventative care, but then connect you to your local sort of partners once there's new teams that are opening up. I think I would probably say to everyone here today, I want to just look at my time. I'm still good, so so I can keep going for a second. What I was going to say is, circle back to all of those booths. It's so important what Lakeridge has done today. I think it's really important to learn about all of the resources. Public health, for example, has the pop-up PAP clinic for those that don't have a family doctor or a primary care provider. We mentioned the CHC. One thing I did want to focus on is there's in Durham Region, as partnerships in the community and with Lakeridge, there's a lot of really unique programs that we're doing that don't exist anywhere else. And honestly, I would say the community care paramedic program with community care nursing, what we're doing is we're partnering with primary care. So if there is any homebound seniors that or someone with a disability, how are we going to reach them? So I think one of the key things is we're trying to find pathways that other regions honestly are just getting to. And part of the reason we can accomplish it in Durham Region is because we're working together. So I'm just gonna sign off with that. Honestly, I'm so appreciative to Nadia, Cindy, the whole Lakeridge team, but also all the community health partners that are here for you guys. Reach out to us. You can reach out to us through the Durham Ontario Health team as well if you have any questions about any of the programs within the region. Thank you.